first ones that we're gonna do, super easy, is you're gonna go right where the hand is, so between your thumb and your index finger. If you squeeze it together a little bit, the point that is the highest, the most prominent, I want you to press on that, and it's closer to the bone area. And if you're all stressed out and there's midterms and whatever else is going on, you'll notice that it's very tender, not so much for normal people. And this one is where the magic really happens. So for this one, what I want you to do is I want you to keep your shoulders anchored. This acupressure point stands for falling off the pillow. What that means is neck pain, migraines, shoulder pain, all of that stuff. So you got that today, you got yourself a nice deal. So keep your shoulders anchored and look straight ahead, and then move to the right as far as you can, and notice how far you can go, and try not to move those shoulders at all. And then come back to the center, and now do the same on the left side. As far as you can go, notice how far you can go, and come back to the center. Now I want you to do ear to shoulder, and try not to elevate your shoulder blade. Try not to elevate your shoulder. Notice how far you can go. Come back to the center, and do it on the other side. All right, come back to the center. And now, this is gonna be really fun. I want you guys to look at your hand. It doesn't matter if it's left side or right sided. And in between your second and third finger at the knuckles area, just go a little below the knuckles area. It's like in that very meaty area. And if you press on it really hard, for those with neck pain, shoulder pain, and whatnot, it's gonna feel tender. And try to press in like a circular motion downward. And we're gonna do this for another 30 seconds. Give yourself a little self-care massage. Almost there, keep on going. All right, y'all ready for magic? Okay, so I want you to keep your shoulders anchored, and I want you to go and rotate to the right as far as you can go. And notice how much farther you can go now after pressing on that acupressure point for not even a minute yet. Come back to the center, do the other side. Shake those heads, everybody. Come back to the center, and now try ear to shoulder. Come back to center and do on the other side. All right, raise up hands. How did it feel? What did you experience? Who wants to start? Come on, brave soul, let's do it. You.
I felt it, like as I was doing the pressure, I felt it in my neck, kind of just like, it's crazy, it's awesome.
Awesome. All right, what else y'all notice? Raise up hands. Brave soul, yes. Yeah? Awesome. It really improves the range of motion. Every patient that ever does it works super well. And this is one of the special things about acupuncture. A lot of people just think it's needles, and it's like, no, you know, acupressure works really well. Doesn't always need to have needles, although needles have a longer lasting effect. And I'll give you an example of how acupressure is just so freaking amazing. It still blows my mind these days. So just last week, I had a patient come in, and she had sciatica, pretty severe, for the past 2 years. And her level on the pain scale of 1 to 10, 10 being the most severe pain, was between 8, was about 7 to 8, which is very, very severe. For those of you who know about chronic pain, that's a kind of hell that you just don't want to live in. So anyway, she came in and said, I don't want needles at all, I just want cupping. Any of you guys heard of cupping before? All right, we got some people, awesome. She said, I want cupping, and I told her, cupping can help release some of the glutes area and the back area. It will help, but it's not gonna really get rid of the pain. It's just not enough, and I know. So she insisted. She was like, no, I just want cupping. I was like, okay, we'll do that. You know, I have to respect your wishes. And then at the end I said, I'm not gonna charge you for this, normally I do. Could you let me do acupressure? There are no freaking needles, I promise to you, I'm not gonna stick a single pin or needle in you. And I showed her, I was like, this is just a little gadget, it's just a little ear seed. It's coated with 24 karat gold. You cannot possibly get allergic reaction to this thing. And I showed her and I was like, see, it's just a little pellet. We're gonna put it on your ear. That okay? And she was like, all right, we'll try that. So I put it right on her ear and the most amazing thing happened. I told her, walk around, because when you walk, that's when your sciatica really flares up. Like, push yourself. I'm right here, I got you. So anyway, she walked around in a circle around the treatment table. And next thing you know, she looked like a totally different person. She actually said 0 out of 10 is my current pain. Her husband looked at it and said, my God, I've never seen my wife without pain. This is like the craziest thing in the world. No needles or anything. So anyway, she said, yeah, we're gonna send you lots of patients. We're gonna keep coming back for you, of course. But it was just beautiful. It just illustrates one of those things where you don't always need needles. We got tons of stuff in our toolkit. All right, next one's another fun one. These are geared towards students because we sit on our butts a lot. So a lot of us have back pain, happens. Some are nodding, saying, yeah, I got it today. You're in a perfect place. So what I want you to do is I want you to stand up. Loosen up those muscles. Come on, shake it off with me. All right, y'all taller than me now. Okay, so I want you to keep your hip in this position. I don't want you to move it. And I want you to go and twist to your right without moving your hip. Let it be firmly planted on the ground. And notice how far you can go. And then come back to the center. And now do the same on the other side. All right, come back to the center. And now what you're gonna do is, everyone, you can see there is a hand. I hope you have two. And between your second and third finger, if you go where you were earlier, but go further down and right before you hit the bone in that meaty area, that's one of the points. The second point is between your fourth and fifth finger, and between the knuckles, you follow the path downward until you're right about to hit the bone, and you press these 2 points together with your second and third finger, and you press onto them together in a circular motion. Press down as deeply as you can. And if you have back pain, this is going to be tender for you. I see some nods saying, yeah, I feel the tenderness. We're going to do this for another 30 seconds. All right, another 10 more seconds. You guys didn't think there was going to be a magic show today. I am here to entertain as well. All right, I'll have y'all let go. Now I want you to go and do the same motion to the right side again as far as you can, and notice how much farther you can go. Now do the same on the left side. And all of you are now going to owe me $200 for that. You guys can sit back down now. All right, volunteers, raise of hands. What was it like for you? What did you notice? Brave souls, come on, let's do it. I'm going to start picking people soon. There we go, go for it.
I mean, a whole lot less resistance on the second time.
Uh-huh.
Unexpected.
Good job, awesome, absolutely. Who else? Another one person, come on. Someone raise their hands and share their experience, please. Would you like to?
I was thinking my hips definitely were a lot easier to move. and like I was able to keep them stationary and make like a lot of progress, like turning around compared to like the first time.
Awesome. There you go. That's acupressure, guys. Isn't that amazing? No needles, no nothing. Oh, thank you. About to show over. One more. So for those of you who have back pain, and if that first 2 points was not enough, or you're in class and you need to kind of just like write notes and whatnot, and you want some other easy access point, like right where your elbow is, you just kind of move down just a little bit. It's in that forearm area, so when you put it in this position, just right against the bone, that's another really good point for back pain. And the story of this is that I was at UCLA's medical school, and they had an integrative medicine class there too. I took that after I took this class at Berkeley, and I just couldn't get enough of integrative medicine. I thought it was amazing. So I went to UCLA for their summer school because I wanted to try it out. Anyway, I had some back pain that day, and my professor, we were at the East-West Medicine Clinic, and he said, I need a volunteer with back pain. And I was like, oh, take me. I got pain right here. And he pressed, and like, my God, it felt like, oh my gosh, it's like so tender on me. I was like, this is insufferable. What's wrong with you? And why aren't you pressing on my back? Why are you pressing on like my arm? And so he was like, just bear with it. Like, and everybody was staring at me, and I was just like, I want to get my arm off of you over here. And so he let go after about a minute, and he said, move around, try it out. And I was like, ooh, I feel so much lighter. Like, my back feels really good. Like, what the heck? No needles, no nothing, just acupressure. And I was like, okay, you got me. Like, I'm sold. This is pretty amazing stuff. I want to learn this. I want to help other people. Definitely want to help myself while I'm at it too. So that's the story of that. Another really cool acupressure point for those of sinus problems and just regular people too is you go to, this is the nasolabial fold, as you can see from that picture over there. And right outside of the nostrils, if you just press on that, and even for regular people do it, you'll feel the difference. Everyone's got whiskers on right now. Check out your neighbors. This is what whiskers look like. And if you notice, you'll see that you're kind of breathing better now. It's easier to take a deep breath, and it feels more clear. Nod of heads if you felt that way. Awesome. So next time that you've got a stuffy nose when you got a cold, just remember, cat's whiskers works really well. And this is a little thing from UCLA's oncology center. So they treat patients with cancer, and they talk about how acupressure can help with that. Acupressure can help manage headaches and digestive discomfort. It can help relieve pain really well, as you have noticed. It improves fatigue. It strengthens the immune system. It relieves stress, anxiety, insomnia, forgetfulness, and palpitations. Does that sound like what students go through right around finals time? Not saying you're cancer patients, just saying acupressure can help you too. So, if you look in the picture over here, there are some different sized needles. A lot of people come and they're like, my God, acupuncture needles must be like really painful, because when I go to the hospital and get my blood drawn, it hurts. Who wants that? And I'm like, people generally don't feel acupuncture needles. If you look at this is the needle that you usually associate with when you're at the hospitals for blood draws. You can tell it's really big because they have to be able to pull your blood out or stick something into it. But acupuncture needles are only about 0.25 millimeter. This one is actually 2.5 millimeter. And I have needles that are even half of that size of that acupuncture needle. You can fit about 30 needles, acupuncture needles, in what you normally do for your blood draw. It doesn't really hurt. They're so thin, it's almost like a strand of hair, like that human hair at the very top. Amazing stuff. And for the World Health Organization, they came up with a list, and they looked at randomized controlled trials And they're like, let's see what is the consensus that we can have about how acupuncture, can help with different diseases. So they're like, we need something solid, a list of things where acupuncture absolutely can treat very effectively. This is not even close to the complete list. This is just a few of the things that they came up with, and there's so much research nowadays to back up how acupuncture can help people. The field has grown exponentially, or logarithmically, I'm not sure, but it's pretty close to them. And acupuncture can help with sciatica. It helps really well with dental pain. To give you an example, actually, I'll get back to that. So dental pain, gastritis, rheumatoid arthritis. Rheumatoid arthritis with acupuncture is absolutely phenomenal in its results. When someone goes to their rheumatologist and get diagnosed with RA, they have about 2 to 2.5 years before joint deterioration sets in. And that is irreversible, whether it's acupuncture or Western medicine wise. But if they get acupuncture early on, and a lot of rheumatologists know about this, they found that you could really significantly stall that process of joint deterioration because it works so beautifully well with lowering the body's inflammation levels. And it also helps with things related to pregnancy. It can induce labor in that need. So like I remember that Friends episode where Rachel was like, get out, get out, get out! I don't want this freaking baby in me anymore. That's when she was pregnant and pissed off, and she was overdue. Acupuncture can actually induce labor. So if y'all feeling like Rachel, there are options now. Another one is it can help with breech birth. Another includes morning sickness. A lot of pregnant women have morning sickness. They don't feel good. If you guys are guys, now you know where to send them to. Acupuncturists. Do not, I know what will make you feel better. Never tell a pregnant woman do not anything. And acupuncture helps a lot with post-operative pain. So one of the examples of that is I had wisdom teeth extraction surgery in the past to extract my 4 wisdom teeth. And I know acupuncture can be used instead of anesthesia in surgery. I want my drugs. I want to be knocked out when you take out my teeth. I don't want to recall a single detail of it. Please make sure I'm down under. But before and after, very okay with acupuncture, just not during my surgery. Don't want to be awake. So they did the surgery, and right before the surgery, I had acupuncture done. And after surgery, I had acupuncture done several times. And I went back to my doctor and I said, you see this? These are all the painkillers you prescribed me. And I said, here's the entire bottle. Count them. Not a single one I've taken. Acupuncture took care of the pain the entire time post-operatively. I had no problems. And that's one of the examples of how it can help with post-operative pain. Acupuncture is amazing with stroke rehabilitation. One of the stories of that is my godmother had a father-in-law, and back then he had a stroke that was right in the middle of the body. Normally it's usually on the left side or on the right side, but his was a very rare case. So anyway, he went from a healthy guy that could live his life to having a very decreased quality of life. He could barely get out of bed. He could barely use the restroom or, feed himself. And these were things that, he kind of took for granted. These are things that we all take for granted that we could do. So my godmother said, no, this is not cool. So she said, send the acupuncturist every day for 2 weeks to his house. And after 2 weeks, he was able to get out of bed. He was a whole lot happier. He was able to use the restroom and recover most of his functions. Now, I'm not saying he ever got 100% of his functions, but it did so much for him. And in America, we're really famous for acupuncture as, pain relief, basically. That's what it's famous here for. But in China, it's most famous for stroke rehabilitation more than anything else. So if you know someone with stroke, here's another tool that you can add to that toolkit to help them have much better quality of life. Other things include essential hypertension. I remember I read this study where it said that these patients have hypertension, so that's high blood pressure, and they found that after 6 weeks of acupuncture care, where they did it consistently and showed up for the study, They found that it decreased the diastolic and systolic number by 10 points. No dietary change, no lifestyle change, just acupuncture. And there are a lot of Americans here that are struggling with high blood pressure. Another tool to add to the toolkit. It also helps with things like allergic rhinitis, peptic ulcer, dysmenorrhea. Dysmenorrhea, guys, if you didn't know that, girls already know this. It just means painful menses. And every woman has gone through probably at least one painful menstrual cramp. Most women have anyway. And acupuncture can help with that. And it can help with depression. So a lot of people are kind of like, why these acupuncture points? I mean, like, can it be like anywhere in the body, or like why specifically would you say this place? Well, there is a reason for that. For the acupuncture points, they found that it's always located in areas with tons of nerves, blood vessels, and lymph vessels, and densely distributed nerve endings and receptors. And it also has a lot of mast cells in the area and highly concentrated neural and neuroactive components. And research shows that acupuncture increases the body's production of serotonin. It also helps with beta endorphins and enkephalin levels. These are your body's endogenous opioids. If you guys get high, don't you ever wonder, I'm not saying you are or not, y'all just laughing, I don't know, but there are receptors in your brain where it's like, hey, it can respond to those opioids. Why does our brain have these receptors? It's because our brains have endogenous opioids that we produce ourselves. Doesn't require a high from other legal or illegal substances, what have you. Not caught up on the laws of all the drugs and everything out there. That said, acupuncture can actually work on this. They can help your body release your own natural get high drugs. Not telling you to get high off of acupuncture. And a lot of people are like, well, back in the old days, we didn't have a common vocabulary. People would be like, tell me how acupuncture works, and they're like, balance chi. And most of you are like, what? What does that mean? Well, nowadays in research, they found some really great explanations of it. This is the proposed anatomical or physiological equivalents to some of these ideas. For example, if you say acupuncture meridian, the equivalent to that, they're saying, is connective tissue planes. High correlation. And if you look at things like qi, this is a sum of all your body's energetic phenomenon. Your metabolism, cell signaling, information exchange going on. There are some explanations for that. And when they say there's a blockage of qi, where like, in Chinese medicine, they say that if there's a channel and there's blockage there, that's what's creating your illnesses and pain in the body. What does it mean when there's a blockage of qi from a Western perspective? There is an altered connective tissue matrix composition that it's altered, it's changed, and it alters your signal transduction as well. And the restoration of the flow of qi, or the whole purpose of acupuncture, is, in the Western explanation, it's for cellular activation. It can alter gene expression. Amazing stuff. And it can help restore the connective tissue matrix. Oh, wow. I didn't sign up for this magic show. And signal transduction. All right. And a few other things. So on to a different topic. Japanese acupuncture is, so many things are near and dear to my heart. I love so many things. So Japanese acupuncture is what I recommend to people who are needle shy. Some people are like, never freaking stick me with a needle no matter what. Maybe acupressure or something else. Let me know what you got in the toolkit. Needles are not involved. Japanese acupuncture works beautifully with that. So one of the ways that Japanese acupuncture diagnoses disease is that they go through the abdomen. Just like in Western medicine, if you look on this picture over here, we have palpation. When you go to your MD and you say, oh, I have pain in this area, they're going to be like, oh, maybe you have a duodenal ulcer. There's a pancreatitis possibly in that area. If you point to another part, they're like, well, maybe it's this. in and they press on it to see what's going on in that area. Well, it's very similar to Japanese acupuncture. They go to the abdomen and they start looking and saying, ooh, I feel this and I feel that. And instead of using needles, they use needles too, but they have an option, and it's great for kids. They're really famous for this because kids cry if you show them a needle and even tell them there's going to be a needle about to hit them. So they use what is called a teishin over here, and they're not really technically a needle. It's really thick. Just imagine like a pen, you know, like what you use for your iPads and whatnot. And that's all it really is, but it's made out of metal or copper or whatnot, and they just put it on the skin, and it's supposed to work just as well as acupuncture. Now, I'm not so good in this part, but I do know that it's certainly an option. It's very famous and especially great for pediatric care. And then next we have Korean hand system, where they have acupuncture and acupressure. And the Korean system is a little different from the rest of acupuncture in the sense that they are very focused on the hand part. So everything that they treat is just pretty much straight from the hand. They also have another system that does the body. But they say that your whole entire body is mapped out straight on your hand, just like how when you press on the hand earlier and you're like, hey, my neck feels better, or my back feels better. So it's kind of like your whole body is over here, and they just say, you know, we can do acupressure. They also have like little pellets that they put on your skin on a sterile tape or bandage, and you can press on it and it just does acupressure. And no needles at all. And next we're going to go into the topic of scalp acupuncture. One of my, I think it's one of the coolest things in acupuncture world, so I'm trying to show you all the coolest things here while you're here. And with scalp acupuncture, they found that for where the acupuncture points are, there's a very strong correlation of how Western medicine sees where it is. For example, here's the motor cortex. That's where we have the motor line. And for patients that are coming in with mobility issues, we go with that. Where the cerebellum is in the back of the head, we also have balance acupuncture points. It's specifically for helping with balance. And I have seen this with patients. It's so freaking cool. They come over here, they could barely walk straight, and by the time they're done with your treatment, they can actually pretty much walk straight and be perfectly aligned and happy. And sometimes it's just within the span of one treatment. So I'm going to show you a picture, a video of what that looks like. Oh, is there a way to do volume here? Oops. What's that? Anyway, you notice how she lifted her arm earlier, and she's having needles right on her scalp, right on the top of her head area. She was never able to move her thumb before. And then after the acupuncture treatment, she could move her thumb. So that gives you an example of how scalp acupuncture can be amazing for patients with stroke. And this is a patient with hemiplegia. So a little bit about stroke. So I'm sure you guys have heard of the word stroke before because it's such a common thing. And there are two types of stroke. I don't know if you guys, some of you are in pre-med. I don't know how much you know about it, but there are two types of stroke. One is the ischemic stroke, and that's what most people think of when they hear the word stroke. And with ischemic stroke, what it means is that there's a blood vessel here, And there's a blood clot that's blocking it, and it's blocking that whole brain blood vessel. And within minutes, the brain cells begin to die. It's one of the leading causes of death and long-term disability in this world. And in the different type of stroke, hemorrhagic stroke, that's where the vessel is already weakened and it ruptures and the blood, it starts bleeding. The blood starts accumulating and it compresses on that surrounding brain tissue. Stroke is a very serious thing. I'm sure a lot of you know some relatives, older relatives that have it, or at least know a friend's family who are affected by that. And currently, the treatment of that we have in Western medicine is, a drug called, it's a thrombolytic drug. It's called recombinant tissue plasminogen activator, or RTPA. And with this drug, one of the sad things about it is that it has to be given within 4.5 hours of stroke in order to be effective. That's a very small time frame. 4.5 hours only. And some people aren't even discovered in that time where they can send them to the hospital yet because they're like, well, I didn't know Grandpa fell. And one of the things that makes this drug a really difficult thing to use is that it often results in intracranial hemorrhage. So the drug that you're trying to do to save that person's life might have a side effect of intracranial hemorrhage, not the side effect you want. Maybe nausea is not too bad to have, but not hemorrhage. And because of this time limit, because of the side effect, it really restricts the use of this RTPA drug. Now, what's another possible option? Acupuncture. Acupuncture has been used for post-stroke rehabilitation for thousands of years. And they found with research studies that it actually helps the stroke recovery through the process of neurogenesis. What it does is that acupuncture helps with the neurological deficits that patients experience, and it reduces brain edema powerfully. And it is so effective in neurogenesis, and they found that the optimal treatment time is you try to do it preferably within the first 2 days of someone having a stroke, and 2 days is very doable. It's not 4.5 hours compared to the drug. And even with, particularly from day 7 to day 14 post-stroke, it is really, really helpful. It's not like Western medicine where you only have a 4.5 hours window. It's significant. We bought more time. And how does acupuncture help with ischemic stroke? Well, they found that ischemic stroke is highly related to oxidative stress. Oxidative stress, it's kind of like wrecking ball. Y'all heard of the song, Miley Cyrus song for Wrecking Ball? Awesome, I love that song. I'm sure you've heard it on the radio. And when your body has all these reactive oxygen species, it's like a wrecking ball just swinging around and it don't care where it goes. Total wrecking ball. And it's gonna hurt a lot of your body. And acupuncture actually acts like an antioxidant. It exerts an antioxidant effect, and it is neuroprotective. It protects that and improves the cognitive function of that stroke patient. How acupuncture works with this is that it regulates these molecular signaling pathways involved in redox modulation, which is another fancy way of saying you see the wrecking ball and you tell it, stop swinging like a crazy person. And that's how it works. So here is a fancy picture of the wrecking ball. So what you have over here in red color, those are your super villains in the case of stroke. They're the worst, biggest, baddest villains ever. And then what you have in green, like SOD, which is superoxide dismutase, it's like Superman. It's got super in the word. And we want more of the green because that's a Superman coming to rescue you, and the red ones are the villains we do not want. And when the red villains that we see, you're seeing nitric oxide, an O2 negative, and it combines in the body and it becomes hydrogen peroxide. Now, hydrogen peroxide might be fine on the outside of your skin for a cut, but your body does not want hydrogen peroxide running amok in the body. It acts exactly like a wrecking ball, destroying things. And what we have is that when you have acupuncture, these pathways that lead to this wrecking ball over here, acupuncture actually says, okay, hold on, let's inhibit some of these pathways, and we'll activate the body's pathways that actually is the cleanup crew. So if you have a wrecking ball just swinging around, breaking tons of stuff, somebody's got to clean this up. Our body has its own ability to clean things, but sometimes it's kind of like a lazy maid and they're just not doing stuff. So acupuncture is kind of like pushing the maid, saying, get up, get off your couch, and start cleaning, because that's what I pay you to do. It helps the body clean this up, and it tells the wrecking ball, stop making a mess, stop behaving like such a horrible, horrible child, stop throwing stuff all over the place. And so that's how acupuncture helps with oxidative stress. It exerts antioxidant effects, and it helps your body to clean itself up. And in this picture, it tells you a little bit about how acupuncture can help. And what it does is that in stroke patients, acupuncture promotes neurogenesis and cell proliferation, cell growth, cell division in the central nervous system. And acupuncture regulates the cerebral blood flow in that ischemic area that has cut and reduced blood flow. And acupuncture helps with anti-apoptosis in that ischemic area. So apoptosis, if you remember from high school biology or more recent classes, is when this program cell death. And anti-apoptosis is, hey, let's not kill off the brain cells. I might need it to function. AI is not smart enough to take my job yet, hopefully. And it also helps with improvement of impaired long-term potentiation and memory after stroke. It is amazing in what it can do. Now, another topic that's really neat is how acupuncture can help with Parkinson's disease. Any of you guys knew that before? We're going to watch a video to see that. Ooh, we have one person, yay. Now we're going to have the whole classroom raise their hands. So this is a 70-year So this is a 77-year-old patient, and she has been suffering with Parkinson's disease for over 20 years ago, and this is stage 3 Parkinson. And take a look at the movements that she's doing. This is very classic Parkinson's disease for any of you guys who haven't seen it before. This is her first acupuncture treatment. What they're going to do is scalp acupuncture. So again, it's acupuncture right on the head to stimulate. They also incorporate a bit of exercises to help in the rehabilitation process, as you can tell. testing how she's walking. That's what gait means. And this is after the treatment. And if you take a look, there's no swaying of the arms or bobbing of the head anymore. Oops. I'm going to show you this thing right here. I want to show you the difference. Do you guys see the difference before treatment and after? How absolutely remarkable that is? All right. So one of the reasons why I love coming here, besides that I'm an alumni of Berkeley, is also because I want to share these amazing things for you guys, because you guys might end up in the healthcare field. You guys might become future doctors, future nurses, future physicians, assistants. And now you guys know about something that could really help patients in addition to everything that Western medicine has to offer. And Western medicine is really great when it comes to emergent care. Anything that deals with an emergency, surgeries, all of that stuff, Western medicine is your go-to. And they've even shown this in research studies done by my professor at UCLA. It's like, emergency, fantastic, Western medicine. But there are a lot of patients that have chronic diseases. And for these things, Western medicine doesn't really have a very great answers. And Western medicine needs a little adjunctive care. And acupuncture is really great with helping in these chronic pain, chronic disabilities. And some famous people with Parkinson's disease that you guys may know of includes Michael J. Fox. He is an actor, and he also, he made some really cool movies. Don't remember the names. There's Muhammad Ali. There's Pope John Paul II. Neil Diamond, the singer. You're probably too young for that. And Reverend Jesse Jackson, who is an influential civil rights leader. There are lots of people who have this. And you can tell from the video that I showed you earlier that there is a slow movement, that's bradykinesia. Parkinson's disease is a chronic and progressive neurodegenerative disease that affects the middle-aged people and the elderly. And you can tell that she had a resting tremor where she couldn't control her hands and arm. And there was postural instability and myotonia. And she also had cognitive dysfunction. Parkinson's disease people, this is very much classic signs of it. They also have emotional disorders like apathy, depression, anxiety, and hallucinations. And I mean, who wouldn't be depressed if they were going through this horrible thing? And they also have autonomic nervous dysfunction. And currently what they do is that even with Western medicine treatments, they're still gonna have physical deterioration. And it's gonna lead to severe disability and death. And drugs that are prescribed in a Western medicine model can control the initial symptoms rapidly and effectively. And this is where you reach that honeymoon period where people are like, ooh, I'm feeling better. This is good. Like, maybe my life can get on track. I might be okay with this. But very soon they find out that the effectiveness often decreases and meds are maybe no longer helpful for these advanced stages. And with the anti-Parkinson's disease drugs, they are only offering symptomatic treatments, and it cannot delay disease progression. And they have a lot of side effects. And these side effects can aggravate the symptoms. When they look at clinical research studies for acupuncture, they found that acupuncture has significant therapeutic benefits for Parkinson's disease patients. They found it helped reduce those motor and non-motor symptoms like you saw in the video, and it may even help to reduce the dose and the frequency of the Western drugs and alleviate those side effects. And the way that acupuncture works for Parkinson's disease is that it helps reduces mitochondrial dysfunction. It helps with oxidative stress, which is the wrecking ball in your body. It helps with protein aggregation, impaired autophagy. Impaired autophagy is kind of like, imagine a kid is pissed off and you told them, do your homework. You know, pretend you're a mom or dad for a second here. And like, do your homework, what's wrong with you? And the kid's like, oh, you want homework? Let me show you. Here's a piece of paper that's supposed to be my homework. I'm gonna crumple it up and toss it straight into the trash can. What the hell are you gonna do about that, mom and dad? So, that's the body's impaired autophagy, where it's like you're supposed to fold these proteins in a certain way, and it's all misfolded and it's all crumply. It's like a kid with a temper tantrum. And acupuncture can help with that process. And acupuncture helps with neuroinflammation. So this is a research study showing how acupuncture works. So if you take a look, in patients with Parkinson's disease, they have a lot of what's called alpha-syn aggregation, and that's no good. It's in red. And what happens is they have autophagy dysfunction. That's that kid throwing a temper tantrum, misfolding pieces of paper and saying, I don't care, what are you gonna do about it? And there's a lot of neuroinflammation, oxidative stress, your wrecking ball, and there's apoptosis, where the cells are just like, let's go kill ourselves today. There's no reason to live anymore. And acupuncture is like, hey, stop being so suicidal. Let me help you. Let me help you get to a better, healthier state. So acupuncture actually inhibits that pathway towards apoptosis. It inhibits oxidative stress. It inhibits your neuroinflammation, and it inhibits autophagy dysfunction. And these are some of the biomarkers in the body that they've looked at, and they say this is helping. And they also found that in patients with Parkinson's disease, that a lot of them have, besides neuroinflammation, they have what's called gut microbial dysbiosis. And what that is, you know, imagine your gut bacteria. There's some good ones, there's some ones that we don't really want. Imagine your body isn't regulating it really well, and you're having a lot of the bad bacteria you don't want, and you're having way too low levels of the good bacteria. So in acupuncture, if you take a look at what the studies show, it's actually helping your body regulate its gut bacteria. Isn't that nuts? And that helps with Parkinson's disease. And here's another example of acupuncture for the question?
You know, do any of the acupuncture needles, are they coated with anything ever? Or are they just
Yeah.
like, yeah, what are they coated with?
I think it's silicone or something else. I forgot the name of the something else. But some needles are coated, especially where it just glides straight in. It's kind of like it just goes through your body like butter, and it makes it way less painful for the needle. Most people just feel a slight pinch, if at all. Most people don't feel anything at all. Good question. And this is an example of a patient with Bell's palsy. So she has been in this state for the past 2 years. You can see that there is a clear, asymmetry between the left side and the right side of her face. Her face is completely hardened. So they're going to stick a needle in there. And you can tell after the treatment, there's partial improvement. Look at the before and look at the after. That's a really significant difference, especially in the quality of life for that patient. So in Bell's palsy, let's see, we're almost out of time, so I'll get to the good stuff. So when they looked at the research studies for Bell's palsy, they found that acupuncture significantly improves the blood circulation or the blood perfusion to that area. And it even improves the facial nerve function and the metabolic activity of the affected facial tissues. And if you take a look at this, blue man kind of picture, this is a person who who has severe Bell's palsy, and this is the before acupuncture. The areas that are not blue, that's your blood circulation. So during acupuncture treatment, these are needles that are there during the scan, and you can tell it's lighting up. I don't know if you guys have ever seen Predator, the movie, and it's like it can detect living human beings by like the color and the warmth and all that. So this is doing the same, where it's like, check these out. Once you have the needles in, it actually helps bring blood flow to the area. And this is after the acupuncture treatment, and you can still see that it's lit up. And that means good blood circulation to the area, which makes a big difference for patients. And this is acupuncture for a temporal mandibular disorder, also called TMJ in the common vernacular. So this is the most that he can open his mouth. Like if you guys all try opening your mouth, you could probably do a whole lot more. And they're putting the fingers, and they're like they can only fit 2 fingers. It illustrates a very good point. So they're sticking a needle. And now they can fit 2 fingers more easily in. And also a lot of patients find that their pain goes down as well, and they're able to move so much better. And this is after the treatment. It looks really goofy because they're sticking fingers in there. It looks really funny because they're sticking fingers in for patients who have TMJ, like really severe. A lot of them, it's like lockjaw. Like I've had a patient who is like, I had to go to the ER because I couldn't put water or food in my mouth or anything or chew because my jaw was just so locked up. So for patients who have TMJ, TMD, it can make such a tremendous difference for them. And let's see. And also acupuncture for those who just want to look naturally beautiful and radiant, which is pretty much everybody. Fun little things. There is something called cosmetic facial acupuncture, and or facial rejuvenation, and it can stimulate your lymphatic and circulatory system and deliver nutrients and oxygen to your skin cells. It can nourish your skin from the inside out and help even out your complexion. And it can stimulate the production of collagen to help improve elasticity in your skin and minimize fine lines and wrinkles, and even help with scars. Works really well with scars. And famous people, including Cameron Diaz, use acupuncture as well. And it's great for the face. And Vogue magazine calls it acupuncture is considered the new, so to say, option instead of a facelift, equal to fillers, Botox, and biostimulants. I'm not saying it's Botox, but it's certainly natural, and it's your body's natural way of healing itself and increasing the production of collagen and making yourself all look really, really pretty. I recently went to this bridal expo, and it was really neat because usually when I see my patients, I'm like, I'm so sorry that you're suffering through so much. It's always, I'm sorry. When I was at the bridal expo where I'm like, hey, try cosmetic facial acupuncture, I was like, congratulations on getting married. This is such a different energy. I love saying congratulations a lot more than I'm so sorry that life has sucked so much. Kim Kardashian is one of the examples of how of someone who uses cosmetic acupuncture. And this is a picture of someone before acupuncture. And after 12 treatments, you can kind of tell. It looks different and glowing and pretty. All people are born pretty, FYI. Yes?
I have a question about the scar appearance. Is it more like the discoloration or texture?
Texture and discoloration. Works beautifully. Yeah. And a little fun picture to scare the crap out of you guys. So this picture, this is not actually how many needles you need in facial acupuncture. This was a research study where they were just like, let's use, I don't know, the maximum amount of needles apparently. Looks like, is it Hellraiser? Something like that. So anyway, but what is shown in this research study is that with 5 treatments and about over 100 needles into that person's face, and the needles are only kept for 10 minutes, so it's really, really short time. They found that facial cosmetic acupuncture significantly improved facial elasticity, and it may be helping by way of increasing blood flow and increasing muscle tone. And this is what it looks like when they're shooting out the needles, because it's kind of like our version of a machine gun. We have that in acupuncture. It shoots out really, really fast. I think it shoots out like 70 plus needles. And a little bit about auricular acupuncture. So this auricular means your ear, and I want you guys to know this story because it's one of those amazing toolkits that we have. So there's something called NADA protocol, and what that is, it stands for National Acupuncture Detoxification Association. It's a protocol that was invented because there were people who are, had drug addictions, and they were finding that it was really, really hard to treat these people. And so what they did was, maybe we could find a way to help alleviate the opioid crisis. And so they would have these patients come in, and what they use is they use this tiny little needle over here. It's actually embedded into the, it's kind of like a piercing, but it doesn't go all the way through to the backside of your ear. And it stays on for about like 2 to 4 days. It can supposedly stay up to a month. I haven't seen that to be the case in general. But it just stays in the ear. It looks like a piercing. It doesn't look bad. The middle picture is like the ugly version of it. This is the cool version. It's 24 karat gold plated, I think, or right around that. And they stick it in the ear. So this is what it looks like. It looks really neat. And you can see that on this side, these are ear seeds. And they're made with, they have Swarovski crystals on the outside. They look pretty for girls and guys or whoever likes these things. Political correctness, guys, political correctness. And so for ear acupuncture, one of the things that it's famous for is that NADA protocol, which was made for addiction and started in the 1970s. It was designed at first for heroin withdrawal. And later on, they found that, it also helped with opium withdrawal, and it helped with all these other things. So detox, reduce cravings, and this is a research study where they looked at the control group is people who go through the traditional rehab program. And when you look at how much they use alcohol in this case, they're like pretty much the same as acupuncture. Acupuncture is the red color. But after they got discharged from their program, from the rehab program, if you look at the blue color, 6 months post-discharge, a lot of people went back to their habits. It's hard, you're back in the same environment, same family, same friends, same neighborhood. It's tough. And when they did it with the acupuncture, the ear acupuncture group, what they found was that they stayed sober. It's amazing. And especially for those struggling with drug addictions, it's a hellish world that they go through, going through all the withdrawals. This is an extra toolkit that can help them. And for those struggling with tobacco use, they found the same thing. Like after they got discharged 6 months later, in the control group, it's like, it's okay. But in the ear acupuncture group, 6 months post-discharge, the levels of tobacco use was significantly lower. Just another toolkit that we can add to help so many people that are suffering these days. And let's see, I'm gonna skip over this. Acupuncture also can help with, for people who are going through chemotherapy and radiation from cancer. It really helps them with so many of the side effects that they go through. And we'll skip this. And another fun thing before you go, is moxibustion, and this is for all the women and for all the guys who have girlfriends or whatever types of relationships. Just another thing to be able to help give relief. So moxibustion is kind of like a ancient laser therapy. It has over 4,000 years of history. And in the past, they used mugwort leaves to do it. Now we use infrared emitter lasers. Works just as well. And they found that even for things like diabetic peripheral neuropathy, it works really well. I have a patient in the past who couldn't really feel his leg because of his diabetes. He had diabetic peripheral neuropathy. And after acupuncture and moxibustion, especially this modality, he was able to feel again. And he was like, oh my God, like, I haven't felt my leg in quite a while. Either that or it was just pins and needles. This was different. And they found that with moxibustion, it can actually create structural changes in the cells. And it also changes the regulation, it regulates the expression of different cytokines that are biomarkers for inflammation. So what that basically means is it lowers inflammation, and it tells the body's wrecking ball and whatnot, hey, let's calm down. We don't need to go breaking things all around. And they can even see this in blood tests. And you can see the difference in cellular structure from this modality. And especially for women who go through painful menses, this is really neat. And let's see, I'm going to show you this study. So in this picture, if you look at that, the first part on the top is talking about the pain intensity on a scale of 1 to 10. And for a lot of women who go through painful menstrual cycles, they found that in the moxibustion group, if their beginning pain at without any treatment was 6.38 out of 10, that's a lot. After 6 months, it went down to only 3.08. And their menstrual pain, in terms of the duration, how many days they have that pain, at the beginning, they had it for about 5 days. And by the 6 months of treatment, they found that it was only 1.23, which is about a day. That's a huge difference for women who, there are some women out there that miss work because they're like, I am in so much effing pain. I have to rest in bed. Almost all of us kind of knows at least one person who's kind of affected that or who needs that sick day. And this is one of the things that can be done for it. And if you look at this one over here, it's talking about menstrual symptom intensity, and it went down from 16 to 4.84. And for the menstrual symptom duration, it went from 20 to 4.51. And if you look at the green color, that's the drugs that some people take. And after they stop taking drugs, their pain level goes back up. And in the moxibustion group, it stays, goes back up a little bit only, but its effects last, is what it's trying to say. And then, let's see, let's get over here. There's a lot of food therapy. Definitely invite you guys to check it out. There's so much literature on how it helps the body these days, and it really helps with lowering the body's inflammation levels. And yeah, and just a little general advice before you guys leave in 3 minutes. I was in these seats that you guys were in too, so some of the advice that I wish I had learned when I was younger in college was don't worry so much, cultivate really good habits, nurture your friendships every day, live an unhurried life. I know it's hard, thank God for Berkeley time. Helps a little bit. Be optimistic, celebrate all the time, find a close group of people that you belong to, that you feel like you fit in. Have a purpose in life, or purposes in life. Be passionate in the things that you do, and nurture real friendships and real relationships. And sometimes changing the frame of mind, instead of how do I feel about this person, value yourself too and say, ooh, how does this person make me feel? That is especially important when you go into relationships. A lot of people are like, oh, I like this person because they have all these titles, or they're really smart, or they're super good looking. That's all fantastic on the paper, but also frame it into, how does this person make me feel when I'm with them or when I'm with her, or they, or all the other pronouns out there. Don't keep in touch, sorry. But yeah, like, how does this person make me feel? Anxious, stressed, or really happy and at peace. Notice that when you go into the world, like even if you're going for a job interview, instead of like, ooh, look at all this fancy company name and all these other things, think of, how do I feel when I'm here? And it takes the stress and the pressure off. Just show up and see, how do I feel? And yeah, just nurture real friendships. One of the things that I learned down the line was you invest in friendships, you give something that's big enough, that's a sizable amount, but small enough where it's not something that you miss significantly if you don't have it back. And test it out and see if that person reciprocates. A lot of us get scared to take a big step towards helping someone, a friend or whoever, or a classmate in need. And you can test it out and be like, oh, I'm not going to do it forever and ever, but I'm going to be nice and see how do you respond in kind. And for a lot of people who live in regret world, and that's where basically, a lot of patients come in and they're like, I wish I'd done this when I was younger and been on a better diet and all these other things. Even in college students, it's like, I regret it, I didn't take that IB class or AP class, or I didn't make the best out of this class and whatnot. Understand that regret is living in a parallel universe that just doesn't exist. Because if you could go back in time, you would have done the exact same thing because you were given a limited amount of knowledge. And even if you knew better, like, oh, I should have eaten a healthier diet, patients say that a lot, it's like, yeah, but you didn't learn it enough yet. You didn't learn it enough yet. It takes time for you to embrace life's lessons. And I hope that you guys will take this with you. I wish you all the best of success and joy and great health. Thank you so much for letting me do this.
I'm so invested. It's kind of crazy.
So these are just questions.